My name is Haaland. I'm a Norwegian social scientist and communication trainer, and I've been working with developing this model, the iCare-Haaland model, for the last 13 years in 9 different countries. We have been developing it in collaboration with doctors and nurses in these countries, and the last country we developed it in was Kenya.
So my name is Mwanamvua Boga. I'm a nurse manager from Kenya, and I've been using the iCare model to train health providers, researchers, and managers.
So Juan and I will share with you how the model works and what are the outcomes of this model. So most people know that communication skills are very much needed for healthcare providers, but that they also need emotional competence skills is far less acknowledged and known. So most of our providers in those countries, they all agreed that the most important skill they needed was the most important skill they learned was emotional competence, how to manage their emotions. And all of them said that they did not know that they needed these skills. So what we train them on in this model is how to communicate with awareness and respect, and how to manage their emotions competently. And so we teach them humanistic healthcare in a practical way. And the foundation for the contents, that is from their own work environment. And in addition, we also look at the research evidence. So, Mona, looking at this, how have your participants from that you have been training, what kind of skills have they learned?
So majority of participants who've been through this training, they really acknowledge now seeing patients as persons and treating them as fellow human beings as compared to before. So they're able to empathize more, respect patients more. And the other thing that they're also reporting is the ability to manage their emotions, and they're able to recognize emotional situations, take a step back, and act in a constructive way, as opposed to before, where they used to act out automatically to emotional challenges. So they see patients are angry and they recognize this, and they're able to step back from automatic reactions and finding reasons behind patients' behaviors, as opposed to acting out automatically as they used to do before. Mm-hmm. So that's a very important skill that they learned in managing their own and patients' emotions.
So what has this led to? What has it resulted in for the trainers, for the participants?
So majority of them are also reporting that when they treat patients with respect and in a more humane way, patients see this and they also appreciate back, and this really gives the health workers a positive energy and motivation to use these skills more. And in the end, they say that they feel more satisfied with the work that they do, and they feel so fulfilled. That's one. And the other thing they're saying, because they're able to manage emotional situations better now, they experience less conflict with patients and less conflicts with colleagues, and this also in turn it makes them able to have less stress in their work and less burnout. Mm-hmm. So they are reporting very important changes in the way they manage emotional situations, which is very key.
And this is also what we see in the 8 other countries. So there's very similar results across the countries. And we see that one major thing that they do differently is that they take responsibility for the training. No, for the communication.
Yeah.
Take responsibility for the communication rather than blaming the patients for the problems, and this is a key change.
Yeah.
So let us take you through how the training is organized. We have 4 different phases, and the training goes over 6 to 9 months. In the first phase, we call that the discovery phase. This is when participants are observing how they communicate. And how is the effect of their communication on others. They do this in their workplace, and they do it systematically over time to really discover what is the pattern of their communication. Very often they get surprised that people are hurt by what they're doing, people shut up or whatever, and they see that this is because what they're doing. This enables them to develop an inner motivation to change, because they don't like to be that way. And this inner motivation to do things differently is really what's the core of the course, because that's what carries them through whatever they are doing differently. So when they do that, they come to the course with a very strong motivation to learn. And this is the workshop, this is phase 2.
Yes, so when they come to the workshop, they're very open to learning, and we use the experiential learning methods in the workshop, where we allow them to share their experiences from their workplace, and we use the interactive reflection, where they share common challenges that they face at the workplace. And this is usually a very important resource, because they get to see that one is not alone in the challenges, but they get to recognize that everybody basically is facing the same challenges, and this is so key into the learning. And the trainer's role here is very essential to facilitate the learning from these experiences from the workplace. And one thing just to mention is sometimes participants come in with very bad experiences of how they have handled their patients, and the facilitators need to be very non-judgmental to facilitate learning from these experiences. So the workshop are very important a part of this process.
Mm-hmm. And when they share these experiences and you facilitate them, and then we link them to theory, then it is also easier for them to remember and pull out the next time they're in this kind of situation. Mm-hmm. So these methods, they have evolved over time in these countries, and they work across these cultures, which is quite interesting to see. Mm. So the third phase now is what we call skills into action. That's again an observation and reflection phase, where they take what they have learned in the workshop and put it into action in their own work. And usually we find they see that the new methods work better, so there is no resistance to putting them into action and continue to use them. So from the third phase we go to the last phase, which is a follow-up workshop. Mona?
So the last phase is a follow-up workshop where participants come back, and the aim here is really to strengthen their skills and knowledge they have learned throughout the process. But more specifically, we focus on deepening skills around handling strong emotions like death and dealing with death and dying, dealing with burnout, dealing with stress, and handling power, bullying. So these are very strong emotional challenges that health workers face in their work, and more often they don't know how to deal mm-hmm. with them. Mm-hmm. So in this follow-up workshop, we focus more on these strong emotions. Mm-hmm.
Mm. Yeah, and especially how to deal with anger and how to deal with power. They say that this is something that they have never learned. Mm-hmm. We see that several years after they have learned these skills, they still use them. So this is a good indication that the skills are sustainable and the learning is sustainable.
Yeah.
So thank you very much.
Thank you.